So today we're going to be doing a control test on our Vtht 2 blood glucose meter. We're going to use our test strips and our control solution. This is going to ensure that our machine is operating within normal parameters. So we're going to take our test strip, and on the side of the bottle there's a code for dogs and a code for cats. And we're going to use our control solution. For this, you want to make sure it needs to be discarded 3 months after it's been opened. This one hasn't been opened that long, so we're fine to use it. So we're going to insert our test strip, and we're going to do for a dog, which is a code 36, and it's already set for that. So we're going to let it cycle through and come up. It's asking for a sample, so we're now going to take our control solution, and I've given it a shake, and I'm going to dispense a drop right here and let it sample it. Okay, that beep means that it got enough sample, and it's going to bring up a number for us. For a dog, we want it to be between 111 and 205. This number is 156, so it tells us that our machine is measuring accurately. So today we're going to do a heartworm test. So we have our blood sample. This particular test you can run on heparinized whole blood. You can also run it on serum if you need to, or Vtht whole blood as well. So we've got our sample, we've got our test, we've also got our buffer solution that we're going to use here. And so we're going to open our foil package. Do 1 drop of sample and 2 drops of the buffer solution. You do the sample first and the buffer second. So I'm going to dispense 1 drop into the sample well. I'm going to let it absorb in, and then I'm going to do 2 drops of our buffer solution. Okay, and then we're going to set a timer for 10 minutes. This particular test is a 10-minute test. Okay, so today we're going to be doing some fecal flotation testing. So this is a commercial fecalizer. It comes with the outer cup as well as this green piece, which is a filter. You want a couple of grams of stool. So we've got our sample, so we're going to seat our filter into the fecalizer cup, and then we're going to use our fecal flotation solution. We're going to fill it up about halfway or so, and then this system is actually made so that you twist this filter, and so then we're going to fill it the rest of the way. We're going to overfill it just slightly so that it forms a meniscus, and now we're going to take a cover slip, and we're going to set this down on top of the meniscus just like that, and then we're going to set a timer for 10 minutes. So I have a slide here for my cover slip. I'm going to grab the corners of the cover slip and lift it off of my fecalizer, and then I'm going to just set it down onto my microscope slide just like that, and now I'm going to take it to the microscope and look at it under magnification. So today we're going to be doing some fecal testing. We're first going to do some fecal flotation with centrifugation. So I have some stool samples here. This stool sample is for my flotation, and I've got about 2 grams of stool in here that I've mixed with some of our fecal flotation solution. Run it through some gauze for a strainer into our centrifugation tube. Okay, so our tubes have spun for 5 minutes, so we're going to take our float tube out, and we're going to fill it and make a meniscus. Okay, and then we're going to take our cover slip here and set it over top, and then we are going to set a timer for 10 to 15 minutes. Okay, so it's been 10 minutes since we put our cover slip on our fecal flotation with centrifugation. So we're going to grasp the edges, the corners of the cover slip, and we're going to carefully take it off, and then we're going to place it on our microscope slide. So this is my sample for sedimentation, and this is mixed with just some regular tap water. Again, about 2 grams of stool, and we're going to again run it through some straining medium here. Okay. Both of these samples are going to centrifuge for 5 minutes. Okay, so our fecal sedimentation has centrifuged for 5 minutes, and now it's sat for 30. So we're going to go ahead and carefully take this out of the centrifuge, and then we're going to use a pipette to, you can use a pipette or you can pour off the water from the top of the sediment. You just want to be careful not to disturb the sediment in the bottom. So I'm going to pour some off, and then I'll pipette off anything that's left. Okay, so I finished pipetting off the rest of my water here, and then I'm just going to take a little fecal, or a little sample loop here, and I'm just going to get a little bit of this sediment, and I'm going to bring this out and put it onto my microscope slide right here. So we've got our sample on here, and then we're just going to take a cover slip and put it right down under the top. You can put some iodine on here, Louisville's iodine, but you don't have to, it's optional. This is our slide that has our sedimentation, our fecal sedimentation on it. So we're going to put this on the microscope, and we're going to find the corner of our slide and get everything in focus here. And then we're just going to go in a back and forth technique. I have it on a 10x magnification. You can go down to a 40x if you are looking for a smaller parasite, egg, or protozoal parasite. And so as I go across, I'm just varying my fine focus so that I make sure that I see everything that's on the slide. We are going to do first a direct smear. So I have a microscope slide, I have some cover slips, I have some saline. I'm going to first put a drop of saline onto my slide, and then I'm going to take a applicator, a little bit of my stool sample here, and you really don't need much for this. Kind of mash this around in this saline, and I want the pieces to be as small as possible, because if you have big thick pieces you can't see those through those on the microscope. And then I'm going to take my cover slip, and I'm just going to place this down over the top of my sample, just like that, and then we're going to look at it on the microscope. Okay, so we are ready to look at our direct fecal smear, and so I'm going to put it on the microscope right here on the stage. I have this on a 10x magnification. You will sometimes go down to a 40x if you need to look at something a bit closer. So I'm going to start at this 10, and I'm going to find the corner of my slide and get everything in focus, and then I'm going to just go in a back and forth pattern all the way across the slide, and everything that I'm seeing is pretty normal. Doing serological testing on the sample that I drew from Smith. I have a rotor for our Abaxis machine, and we have it turned on and it's warmed up. I have a calibrated handle and a disposable tip here. We can use either heparinized whole blood, which I have here in my green top, or we could spin our serum separator tube down and use the serum. So I'm going to agitate my sample a couple of times and then take the lid off. I'm going to fully depress my plunger, place the tip into my sample, and then release. That's going to pull up that very specific amount of sample that I need. I'll replace this lid so I don't spill it. And then on this rotor there's a hole here where the sample goes in. So I'm going to kind of slowly dispense this sample into that well, and it's going to spread across into the area where it's supposed to sit. Okay, so we've got our sample loaded. Now we're going to open our drawer on our machine. We're going to place our rotor in the machine, and we're going to close it. So we're going to select our species type. Number 1 is a dog, and this is a dog. We're going to input our patient ID. And so then our results are going to be ready in 13 minutes and 18 seconds. We'll print those when they're finished. They print on these cards that feed into the front side of the machine. So today we're going to do an ear cytology. We need a swab for each ear. We need a slide to put our sample on. So we're going to start with this left ear. We're gonna hold the ear up. I'm gonna take my swab and perpendicular to the floor, I'm gonna go into this outer canal. I'm gonna go down to the bottom of the canal and just give it a couple of twists to get my sample. And then I'm gonna come out. I'm going to break this swab so that I mark it as my left ear so that I know which ear is which as I'm getting these samples. And same thing for the other ear. Once I've got my samples, I'm going to make my slide. On my slides, I always do the left towards the frosted and the right towards the end. That way I know which sample is which. And so I'm going to roll this sample on here. I'm not smearing it because that can damage the cells. We're going to heat fix and stain our slide from AZ and his ears. I'm going to use a hair dryer to heat fix. Okay, so a few seconds on that. Then I'm going to come over here. We're using a Diff Quick stain, so we're going to start with our fixative, and we're going to dip it in, and we're going to do about 10 seconds in the fixative, and we're going to kind of move it around a little bit, agitate it a bit so that we make sure that it gets good contact with all of the cells. Then we're going to go straight into our eosin stain, and then we're going to come out of that and we're going to go straight into our counter stain. And then we're going to turn this water on very gently, and we're going to rinse the back side of the slide. We're now going to dry this slide, and then we'll look at it under the microscope. Okay, so we have our cytology for our ear here, well, 2 ears, and so we're going to look at it. We're looking to see what type of infection this dog has. So typical things that we see, we're going to see bacteria, cocci versus rods. We will often see some yeast. Every once in a while you'll get something wacky like a ringworm fungus, and then sometimes you'll get something like a mite. We will sometimes get a Demodex mite. We're also looking for white blood cells, which indicate pus in the ear. So we're going to look at our slide. I have it under oil immersion, and I'm going to start on the left ear. So I'm going to start out, and the first thing that I see is some keratinocytes, which are the skin cells. I also see some cocci in here. It's not an overwhelming amount, but it is more than what should be in the ear. You will see some occasional bacteria and yeast in the ear as in a normal ear, but if there's more than just a few on the slide, then it's usually considered abnormal. And especially if the dog is symptomatic, we're looking for what could be causing those symptoms. So I'm going back in a back and forth pattern so that I'm seeing, all the cells. I'm still seeing some cocci. There are 2 different sizes on here, so there are some large and small cocci, and so that's often important to note because that can mean that there are 2 different types of bacteria here. I'm also seeing some yeast. I have not seen any white blood cells on this slide. Okay, and so now we're going to move over to our right ear. So there are some keratinocytes on here. I'm seeing a few yeast, and I haven't seen any cocci yet. Definitely haven't seen any white cells. This ear has a lot less material in it, a lot less debris. And I am just altering my fine focus some as I'm going across, making sure that I'm seeing all of the cells that are on here. There are a couple of small cocci. This ear would be what I would call no abnormal findings. I've seen a couple of cocci, I've seen a couple of yeast, but fewer than 1 per field.
The patient appears to be an elderly, intact male beagle who is a cryptorchid. Pale gums, advanced dental disease. It's really worn incisors. Eyes sunken. Has papillary growth on the lower left eyelid. Moderately thin. Has probably a very large lymph node, or maybe this is the other maybe this is missing testicle. Yeah, it's the right side that's missing. There's a large nodular mass right with prepuce. Alright, so let's go ahead and get samples of what we know to be abnormal, which is this and this lymph node. Gelatin is probably something called a seminoma. Think it's probably a metastatic lesion to a lymph node. I'm going to run my virtual program. You can tell it's the exact same consistency.
I'm going to make sure to label these as to what we're getting. So this is suspected lymph node. And this is suspected testicle. This patient came from the shelter, so we don't have any true patient identification, but if we did, we would put the patient's name on here as well as the date that we're collecting these samples so that we know who they belong to when we're ready to send them off.
And here's the opposite testicle. And you can tell it's atrophied, which would be consistent with the contralateral testicle producing excessive amounts of testosterone, which may argue that's my case of seminoma. Maybe an interstitial cell too.
So that's the right testicle, correct?
That is correct.
Okay. So in these specimen bags, we would, if we were going to send these off, we would put these in with 10% buffer formalin so that we could preserve these to be sent off to the lab so that they could test them.
Some routine stuff. We're going to split the kidneys longitudinally. Butterfly. Little infarct right there. Peel the capsule off. Cortical lesions. And look at the urinary bladder. Just leave in situ. And it comes. Looking at the lungs, I suspect that's euthanasia solution, but I don't know. I don't know if they still do intrathoracic sticks or not on elucidated dogs. Anyway, grab the right ventricle between the fingers, put that into the chamber. My scissors, take it up through the pulmonic valves into the pulmonary artery. Heartworms.
Oh, yeah. Huh. That's pretty cool.
Okay. That's the pulmonic valves. You can see the leaflets. Right there, right there, right there, going into the pulmonary artery. There's tricuspid valve. Kind of buggered up. That's part of it.
That was chordae tendineae, wasn't it?
Yes, that right there.
Yeah.
More of it right there is valve. My fingers. Okay. All right, so then I go from there, go right down through into the left ventricle. That's how much thicker it is. And we're looking at the back side of the mitral valve. Let me get this stuff out of here. And the aorta goes up that way. We'll cut that into that right now. There's the aorta, and here are the aortic valves. You can see just how much thicker everything is on this side. The artery coming out there is so much thicker. The ventricular walls are thicker. Normal looking heart, even for having to have heartworms. If we had a specific lesion, we'd submit it. Otherwise, just kind of book leaf this lung like so. If we were taking the sample. Spleens of normal size. Proper sample. If you don't see a lesion, it'd be just really look. So cut that out and see how to form one. That's weird. We took the pattern from the bars it was on. Anyway, oops. Let's got a little bit of that's mucus. There was a stone. Leaf the liver, looking for lesions, just got a whole bunch more surface area this way, just kind of looking. There's something, I don't know what it is. I don't know if it's a parasitic granuloma or whatever. It's got some foreign bodies, there's a rock. You still recording?
Mm-hmm.
Okay, some rubbery plastic stuff. More rocks. Before I got this far, I probably should have collected my pancreas samples. As long as there's no lesion, it's okay. Just take a tip off the head or the tail. But I should look at the pancreas. Plastic his last day or two. It's all through his digestive tract. And that's enough.
So if we have a rabies suspect that comes in that needs to be sent for testing, we try to only have the staff that has had pre-exposure rabies vaccines handle the pet, and especially, the doctor tries to take the lead as far as handling these pets. Once they're euthanized, if we are sending them off for testing, the brain material is actually what needs to be tested, so we typically will take that head off, and in the handling we want to make sure that we're wearing proper protective gear. So we wear gowns and masks and gloves. We also use some eye protection because we don't want any splashes getting into the mucous membranes. And then we're going to send the entire head off for a dog, and it's typically double bagged and sent overnight mail in a cooler so that it stays nice and cool. And we're going to send it out to the state lab. You can freeze the head, but it's not recommended because it does have to be completely thawed before they can perform testing. And you cannot preserve it in formalin. If you do that, they cannot complete testing. So we're going to send those off. And then as far as the rest of the pet, we're typically going to double bag that in a typical disposal bag, and then we're going to send that to the crematory so that it will be cremated. We don't want to send that to the landfill or let the owners bury it because of the potential of future contamination. Today we're going to be getting a vaginal cytology. Our patient is Lady Jane. She's a 3-year-old English Bulldog. Supplies needed: we need some cotton swabs, we need microscope slides, we are going to use an ear cone as our speculum, and then we also need staining for the slide after we get it, but we'll go into that once we get to that step. So we're going to start out opening our swabs here. And we're going to take our ear cone, we're going to go right at the dorsal part of the vulva. We're going to go in with the cone at a vertical angle to the top of the vestibule, and then we're going to kind of make an angle here. I'm going to take our swab and go through the cone and into the vagina. We're going to give it a couple of rotations to get our sample, and then out we come. And then we will take this and we will roll it on our slide. We want to roll it rather than smearing it so that we don't damage the cells that we're getting. And then we're going to take this and fix it and then stain it. We're going to stain our vaginal cytology. We're first going to fix it, and we are using a Diff Quick stain. There are several different stains that can be used. This just happens to be the stain system that we have here. So we're first going to use our methanol fixative, and we're going to submerge the slide. We're going to give it 5 to 10 dips just so that we fix those cells onto the slide before we move them into the stain. This is our eosin stain solution, and so we're going to go straight from the fixative into there. Again, we're going to do 5 to 10 dips, and then we're going to go into our counter stain here. Once we've finished our dips there, we're then going to take and we're going to use a light stream of water on the back side of the slide to rinse the remaining stain off. And then we're going to dry the slide and we're going to evaluate it under the microscope. Okay, so we're going to evaluate our vaginal cytology slide. I have it stained and dried. I have it on the stage, and I've got it on an oil immersion, and we're going to be looking to see what stage of cycle this dog is in. So I am going to scan the slide, and I'm going to go in a back and forth patterns, and within this slide I am seeing a fair number of intermediate cells, but I'm also seeing a fair number of superficial cells. They are still nucleated, most of them. They're not cornified. I'm also seeing a fair bit of bacteria, but I've seen very few white cells so far. I do see one white blood cell there, a neutrophil. I see some erythrocytes, but not a lot. So based on this slide, I would categorize this dog as being in late proestrus. So when we're talking about the 4 stages of vaginal cytology, we're talking about anestrus, which is the period that's most commonly observed in dogs. It's the period between heat cycles, so you're going to see mostly intermediate and parabasal cells. You're going to very rarely see any neutrophils or red blood cells or bacteria. It's kind of the resting cycle or the resting stage of the cycle. Then you go into proestrus, where you're going to see primarily intermediate and parabasal cells. You're going to see a big increase in neutrophils and red blood cells. You're going to see some bacteria. And then you're going to go into estrus. As they go into the actual estrus part of the cycle, you're going to see a rapid drop in all of the cells except for superficial cells. Superficial cells are going to skyrocket. That's primarily what you're going to see on an estrus slide. You're going to see very few neutrophils, very few red blood cells. You're not going to see very many intermediate or parabasal cells at all. It's going to be mostly the superficial cells. Most are going to be cornified or keratinized. They're going to be anuclear, and then as they go into diestrus, you're going to see those superficial cell numbers drop off. You're going to see an increase in the intermediate and parabasal cells. Diestrus can be very difficult to differentiate from anestrus. So if the owner has an idea of where they are in the cycle, that's really going to help. Diestrus is also going to be what the vaginal cytology is going to look like during pregnancy. Campbell, we're going to be doing a skin scraping on him. We're checking to make sure that he doesn't have a type of mange. And so we have a tin scalpel blade, we have a slide to put our sample on, we have some mineral oil in a dropper jar. We've already shaved a small spot here on the inside of his leg with a 40 blade just to get the hair out of the way so that we have a good place to scrape. So the first thing that I'm going to do is I'm going to get a little bit of this mineral oil and I'm going to put it on the slide here. And then I'm going to take my scalpel blade. I'm going to run it on this metal a little bit just to dull it just a touch, and then I'm going to dip it in this mineral oil. Okay. Now I'm going to take my place. I'm going to brace the skin so that it is nice and taut. I'm going to use a 45-degree angle and scrape this skin. And because we're looking for Demodex mites on him, we're going to do a pretty deep scraping. We want to get all of the top layer here so that we make sure that we collect any mites that might be here. If we were looking for something like sarcoptic mange, we would do more of a superficial but wide scraping because those mites are a lot harder to find. And I just gave it a little bit of a squeeze there to kind of encourage those mites to come out of the hair follicles. Okay, and as you can see, I've got a good bit of material on my blade here, and now I'm going to put it into my mineral oil. So this is our skin scraping from Campbell. We're going to put a cover slip on here, and we're going to put it on the microscope. We're going to look at this under a 10x magnification. So we're going to find the corner of our slide, and then we're just going to go in a back and forth motion, and we're looking for the mites. We're also looking for the mite eggs because sometimes those will be present. And for this dog, we're specifically looking for Demodex mites. There are a few different kinds of Demodex that can be present. We can also look for sarcoptic mange mites with these skin scrapings. And as I'm going across, I am varying my focus a bit with the fine focus. And this is my last pass here on this slide, and it is negative. So today we're going to be doing cross-matching procedures. I have a non-additive tube and an Vtht tube for each of my patients. One is my donor, one is my recipient. I have them both clearly labeled with names and whether they're donor or recipient. Both of these samples for each patient are going to be centrifuged. We're going to get the serum from the no additive tube, and we're going to be using the red cells from the Vtht tube. Okay, so we've spun our samples, and now we're ready to separate our serum off of the non-additive tubes and to wash our erythrocytes in the whole blood tubes. And this is my whole blood sample from Bert. So for this sample, we're going to actually wash these erythrocytes that are in here. So we need to decant this plasma first, and I've got just a spare tube here that I'm going to decant into. Get the rest of it off here like this. Okay. I'll take a couple of drops of these red cells and put in here. When done with that, we're going to now fill the rest of the tube with saline. And then we're going to put this back in our centrifuge. We're going to spin it for a minute. This is Fred's serum. And so we're going to get one of Fred's tubes. We're going to take a clean pipette and we're just going to set this aside. We'll use this later on in the process. Now I'm going to pull out my other tubes, spin, wash my erythrocytes for Fred, and then we'll put them back in the centrifuge to spin. Okay, so now we're going to do our second washing of the erythrocytes. So I'm going to pull my tube out here, and as you can see, it's spun down our red cells, and we've got our supernatant here. So we're going to pull this supernatant off. Okay, and then we're going to fill our tube again with our saline here. Okay, we're going to gently mix this. And then back into the centrifuge it will go to spin for another minute. Our erythrocytes just finished their second wash cycle, so we're going to take them out and we're going to make our cell suspensions. So this is Fred's sample, and so we're going to decant our supernatant. And our supernatant is clear, which is a good indication that our erythrocytes have been thoroughly washed. And now we're going to take, and we need 0.02 mLs of our erythrocyte solution here. And this is Fred's, so I've got a tube here labeled Fred's cell suspension. So we're going to dispense 0.02 into our cell suspension jar. And then I have 0.98 mils of saline already pulled up here, and so we're going to dispense this into the same tube. And I'm going to do the same thing for Bert's sample. Okay, so now we have both of our cell suspensions made. And so now it's time to do our major and minor cross-match procedure. So for the major procedure, we're going to use 2 drops of the recipient's serum, and we're going to use 2 drops of the donor's cell suspension. And then for the minor cross-match, we reverse that. We do 2 drops of the donor's serum with 2 drops of the recipient's cell suspension. And we're going to put them into these labeled containers. We're also going to make controls, so we're going to mix the donor cells with the donor cells, and we're going to mix the recipient cells with the recipient cells. So we're going to start with our major cross-match. So we're going to take some more pipettes here. So this is 2 drops of the recipient serum. So our recipient is Bert, and this is his serum. And so we are going to put 2 drops of his serum into our major tube. And then we're going to take 2 drops of our donor, Fred's cell suspension. And so we're going to take 2 drops of this. 1, 2. And we're going to just gently mix this so that it gets evenly distributed, and then we're going to leave it there, and then we're going to do set up our minor cross match here. And again, the minor is the reverse of that, so we're going to do 2 drops of serum from the donor, and then 2 drops of cell suspension from the recipient. So our donor is Fred, and this is his serum. And I have my tubes labeled major and minor so that I know which cross matches which. Okay, and then we're going to do the cell suspension from our recipient, who is Bert here. And while I have Bert's cell suspension out, I'm just going to put this lid on this minor and gently agitate it. Okay. And then while I have Bert's out, I'm going to go ahead and set up his controls. So remember, the controls are the donor cells with the donor cells. So we're going to do 2 drops of Bert's cell suspension. And then to that we're going to add 2 drops of his serum. Okay, and then we're going to do the same thing for Fred. We're going to let everything sit undisturbed for 30 minutes, and then we're going to come back and check our results. Okay, so our samples, our testing have sat for 30 minutes, and then I put them into the centrifuge. They've spun for 1 minute, and so now we're going to pull these tubes out and check for agglutination to see what our matches are. And this is Bert's control, and the supernatant is not hemolyzed, so that's an indication that there's no macroagglutination. And then we're gonna give it a little mix here. Okay, and then we're gonna look for any clumping of cells. And I don't see any here. So now we're going to take a drop of this sample. And this is Bert's control tube, so this is just making sure that Bert doesn't have any agglutination issues all on his own. I have 4 slides here. I have them labeled with major and minor, Bert and Fred. So I'm going to put a drop on Bert's slide and then set this to the side. We'll go ahead and put a cover slip on here. And we're going to take these to the microscope and look at them for microagglutination in just a minute. So this is our minor cross match. So again, the supernatant is not hemolyzed, so that's a good indication on this one. So we're gonna again mix our sample up, and I'm just gently tapping the end of this tube to get it mixed together. And then again, we're gonna look for this agglutination, which is a clumping of the red cells. And it looks good. So now we're going to take our minor cross match and we're going to put a drop on our minor slide. Like that. And then we'll set this to the side. Place my cover slip on here. Next we have Fred control. The sample is not, or the supernatant is not hemolyzed, so we're going to go ahead and mix. And then we're checking for agglutination. That looks pretty good. So now we're going to put it on his slide. All that we have left to look at is the major cross match. Okay, so this tube is our major cross match. We are not hemolyzed for our supernatant, and now we're going to look for the agglutination. This actually looks really good. Alright, so again, we're going to put this on our slide, and then we're going to go to the microscope and we're going to look at all of these slides under low power to check for microagglutination. And assuming that we don't see anything there, then we're going to call these cats a good match. We'll put our cover slip here, and then we'll go to the microscope. So this is our major cross match, and so we're going to look at this under low power, and we are looking for any clumping of the red blood cells. We want to see a nice even distribution across the slide. If they're clumped, that indicates that there is agglutination and that this would not be a good match. And so as I'm scanning back and forth across this slide, I'm not seeing any clumping of these cells. Everything looks very uniform. And everything looks very good on this slide. Everything's very evenly distributed. So that's a good major cross match. And so now we're going to look at our minor. And so this minor cross match looks good. And so now we're going to look at the patient controls just to make sure that there's no agglutination. Okay. And then the last one to look at is Fred's control. And I don't expect to find any on this either based on the results from the major and minor cross match. So with these test results, we would say that these cats are a good major and minor cross match, and that we should be able to go forward